Okay, so I'm Emma, and I'm here today with my colleague Denise to introduce ourselves as the FBMH Impact team. Hopefully, we already know some of you on the call. We're actually 2/3 of the team, as you can see, along with our colleague Deb Bentley, whose lovely face is there for you. And she's also on the call today. So firstly, I'll clarify what we mean by research impact, because it might not be a familiar term to all of you. And then I'll let you know who cares about research impact. And then Denise will hopefully go through some of the practical ways to plan for research impact and how you can evidence research impact. Okay, there are various specialist teams across the university who also support aspects of impact with their expertise. And we're happy to signpost you to the various teams if you're unsure who to approach. So I won't go through this in detail because you'll be very familiar with many of these teams, I'm sure. But just briefly, we've got the cultural partners. There are comms and marketing teams, both within the faculty and centrally. Translation Manchester's on there, of course, and Health Innovation Manchester, which links the university to the trusts. We've got the Innovation Factory, which supports patent spin-outs and licensing, and the Masood Enterprise Centre, which is for entrepreneurial activity. And then finally, to complete this circle, we've got the patient and public involvement, social responsibility and engagement, and the Policy at Manchester platform, which supports researchers with policy work. So what is research impact? Well, it's about making a difference in its simplest form. It's the change that has resulted from your research. So our University of Manchester research moves out beyond the university and beyond academia to affect positive changes or impacts in the real world. So here are various examples of the different categories where impact could be achieved. We've got production. So an example there could be that they've improved productivity or working practices within a sector. We've got commercial and economic impacts. An example would be the creation of a new spin-out company, which might create new jobs in a local area. Environmental impacts, this could be the development of a new process, for example, one which uses less energy in production. Health and well-being might be the most familiar to most of us on the call today. An example here would be a new drug or therapy or a new diagnostic or medical technology that has improved patient outcomes. A policy impact, that might be a change to the delivery of a public service, for example, through NICE recommendations, or that a new technology is being adopted within the NHS. And then finally, awareness and behaviour. This might mean that public debate has been informed by our research, or people's opinions have changed as a result of being able to make informed decisions. So I'll move on now to look at, aside from those who directly benefit from our research impact, who else cares about it and why is it important? Well, firstly, we'll consider the University of Manchester's perspective. Impact is central to the university's strategic vision to be globally recognised for the benefits we bring to society and the environment. And our progress towards achieving this vision will be assessed by various measures of impacts on society, culture, the economy and environment, as well as through recognition of innovation. Impact is celebrated annually through the Making a Difference or MAD Awards, and submissions to external impact awards such as the Guardian University and the Times Higher Education Awards are encouraged. So let's look briefly now at the UK's position and the UK government's position and the Research Excellence Framework. So the Research Excellence Framework, most recently REF 2021, that's the UK government's system for assessing the quality of research in higher education institutions. So here are the aims of REF. The first is aim there in simple terms, accountability. It's just meaning that if you're spending the public money, obviously you've got to demonstrate the benefits of that investment to society. And then obviously the second and third aims are important to all universities, including our own. Point 3 is the QR, or quality related funding, which the university receives from the government, and we very much need this to function as a university. So the REF process drives around £1.6 billion worth of public money for research each year. Assessment of impact beyond academia was included for the first time in REF 2014, and in REF 2021 the weighting of impact in the process was 25%, and that was up from 20% of the previous REF. So in simple financial terms, one 4-star Ref 2014 impact case was worth around £324,000 to an institution. And in Ref 2021, it's estimated that this will be worth over £500,000. So the University of Manchester has now submitted 160 cases in March of this year, and we are waiting for the results, which will be out in April 2022. So finally, the last bit in this section, I'm going to talk about funders and why they want impact. Funders like to see both an immediate benefit and a legacy from their funded research. With translational research, we're probably a little bit further down the line in the journey of impact as opposed to basic research, perhaps. So in translational funding calls, funders are often quite specific about what they want in terms of impact, and so this needs to be addressed in proposals when you're submitting to translational research schemes. So I'm sure you're all familiar with the Translation Manchester's pathway. And if we add a few funder schemes over the top of this, then we can look at a few examples of the impact requirements in these schemes. So firstly, I'll look at the MRC Developmental Pathway Funding Scheme, or DPFS. This is a preclinical development and early clinical testing scheme. UKRI's funding finder is useful here because it does give you a lot of detail about the calls, including how the projects will be assessed, as you can see here. So in this one, we can see that they're looking for real impact in terms of improving treatment, reducing disease, or improving quality of life. And then next, we've got NIHR and their Invention for Innovations, or I4I awards. So they've got both the Product Development Awards and the Challenge Awards. The Challenge Awards support market-ready innovations. And I haven't listed all the criteria here, but you can see this is the first criteria on both of these awards. And basically, they're confirming that the aim is to have an impact on NHS and patients. So we'll quickly have a look at a charity-funded example, the British Heart Foundation. These support technologies specifically benefiting cardiovascular health. And this funding goes right through from proof of concept to being ready for commercial launch. And it's specifically stated here by BHF that they're looking for projects which impact on unmet clinical need. And finally, we've got Innovate UK. And they offer knowledge partnership grants, which are assessed on the potential for economic growth and societal impact. And they also offer SMART grants. And in the last call for these, they wanted ideas leading to new products, processes, and services. And they also required a clear evidence-based plan to deliver significant economic impact. And we're remembering here, of course, that these are UK government grants. So they're talking there in terms of impact on the UK economy. So if you're completing a research application, please do feel free to contact us with the draft because we can provide feedback on that for you in terms of impact. We're happy to help advise on how to include impact within a proposal. And at this point, I'm going to stop sharing that screen and pass over to Denise. Denise, do you want to see how you go with your connection?
Great. Okay. Thanks ever so much. As Emma's alluded to, most funders now require you to consider plans for generating impact at the application stage. So perhaps the next thing we should consider is how to plan to achieve your impact. And there are several approaches. The first one is called the passive approach, where you do your research, you publish your research findings to academic colleagues through the usual routes. And if you're lucky, someone outside academia will find them and apply them for the greater good, somewhat serendipitously. This is what probably tended to happen in the past, but we certainly don't recommend that it's done today. Another approach is the active approach, where you do your research, but then you identify potential partners or beneficiaries and approach them with your research findings to encourage them to take them up and apply them. And again, it's not what we recommend, and it's not really what funding bodies are looking for in an approach to generating impact. The best approach, as you can probably tell by the title, is the proactive approach, where even before you put pen to paper, you identify the potential stakeholders or beneficiaries from your research, engage them from the very beginning, co-design your research with them, involve them in your research proposal, involve them in your research project, and ensure that mutual aims are met by the end of the work. And this is often referred to as co-production. But I think the key message here is to really drive home that we need to start planning for research impact as soon as possible, as soon as you come up with a really good research idea. So we need to think about creating an impact plan and engaging with stakeholders as early as possible. Impact is not something that you can leave to consider halfway through your project or at the end of the project. It needs to be thought of at the very, very beginning. With an impact plan, nobody expects you to follow it to the letter, because you may find that you come across bumps in the road that means you take a different pathway, but we can mitigate for that so that, you know, we get to the impact stage as well as we can, despite the bumps in the road. So it's good to start asking ourselves questions at the very beginning, such as, what is the problem that we're trying to address? And how will your research address this problem? And if you're identifying an unmet need, don't assume that you necessarily know what this need is. If you assume that you know what the need is and you work solely in that direction, ultimately you might find that no one takes up your findings because they haven't addressed a need that they think needs to be met. And so you won't achieve the impact that you were hoping to. So this leads us to the second point. Ask yourself, who outside of academia might be involved, such as communities, sectors, organizations, individuals. And if you're not sure about key stakeholders in your area, you're on the subject, look beyond academic sources to see who's talking about the problem, check the news and social media, and just keep an eye out for who's talking about the area that you're interested in. Ask yourself, how and when could you engage with these non-academic audiences? And there's a number of things that we can go through here, but just very briefly. As we've said, engage your stakeholders as early as possible. Engagement is a two-way process. Read widely and identify your stakeholders, and don't be afraid to speak to senior academics to see if they can put you in touch with colleagues of theirs that may be able to help you with your. So if you think Professor X might be able to point you in the direction of Dr. Y, please contact Professor X and don't be too shy. And get your face and your work known. So we mentioned social media before, so Twitter, LinkedIn, you could build your own website, set up your own blog, attend events related to the work in the field you're interested in, build up your network, and be flexible in your approach and do what works for you. We also need to think about how to track the impact and document the impact that we're having. And we need to evidence the change and or the benefit that's happened as a result of our work. So there's plenty of ways that we can help with that, including, you know, getting testimonials from stakeholders is one excellent way of doing this. And think about the resources that you need to deliver your impact. So most funders will pay for any materials you need, any expertise that you might need to bring in, or any training, such as media training, that you might need to provide. So put that in your funding proposal. And you've probably heard of this company before, but Fast Track Impact was set up by Mark Reed. He seemed to be an international impact guru. He's a bit sort of like, you either love him or hate him, but he has a wonderful resource on his website on all aspects of impact, including how to plan your impact. So if you get a chance, please have a look at his website. So how to write about impact in your funding application. But we'd like to highlight to you a couple of resources that are already there for you to have a look at. So there's our faculty intranet page with on impact with lots of how-to guides, etc. And also there's an impact section in the faculty grant repository. So if you get a chance, please have a look at those websites, and we're adding to them all the time. Just to reiterate what Em said, impact is a change of benefit. It really is, you know, the provable benefit of research in the real world, and it's beyond, it's impact beyond academia. And as a reminder, stakeholder engagement, it's a two-way process. It's not you talking at people, it's you engaging with them from the very beginning in a two-way dialogue. Ask yourself what activities you'll need to carry out to achieve the benefits. So, and be specific. So say what you're going to do, when you're going to do it, how you're going to do it, and who you're going to involve in order to do it. Don't say what you will do in your application, not what you have done in the past, because fund bodies want to know what you're going to do as a result of them funding you, not what you've been funded to do in the past. Don't confuse activities and impact. So activities being pathways to impact, and impact being the actual benefit or change that's resulted from your work. So for example, if you hold a workshop, that's a pathway to activity, sorry, pathway to impact. But if somebody from a company attends that workshop and then uses the technique that you've showcased in the workshop to make a change that creates, for example, new jobs or attracts new investment, that's the impact. And how will you know that you've achieved it? Well, there's lots of ways of measuring the impact that you've created. So for example, if you're holding a public engagement event, state how you'll measure the impact of this. So for example, you could have a little questionnaire pre-event and post-event to get people to fill in to see what difference attending your event has made for them. And as we've said before, funding bodies will include reasonable costs for impact activities such as holding workshops and buying in materials. And you can also align your impact plans with your work plans. So you can create a work plan that includes milestones and timelines for impact as well as for your project work. And very briefly, we need to think about evidencing your impact throughout the project and beyond. And the most common question, as you can imagine, is what should I collect? But it depends on what you want to show. And there's no easy answer to this. There's no one size fits all. So what you need to collect very much depends on what you're trying to show. But in general, you need to collect something to show that there has been a change. And in general, it's good to have a mix of qualitative data, so descriptive information which can often come from interviews or focus groups, etc., and quantitative data, numerical information such as number of people that have attended an event that you've held. So start thinking about how you can show that something has changed and that someone or some organisation has benefited as a result of your work. I'm conscious that time's pressing on, I'm very sorry, so I'll just run through these very quickly. So examples of evidence can include testimonials from stakeholders, it can include evidence of media coverage. So like if you've been in the news on a website, make sure you download a PDF of the relevant pages and make sure they're date stamped so that you've got that as evidence, because as we know, web pages aren't there forever. If you're cited in grey literature, such as reports, again, keep an electronic copy or a hard copy and make sure that they're dated. If you're holding a public engagement event, you can have a survey pre and post event. You can get contact details from people, so just a little registration form for their name, their email address, their phone number, so that you can keep in touch with them if you need to see what the difference has been made to them as a result of attending your event. And we need to bank up evidence as soon as it comes up so we don't lose it, and you can easily record evidence in Pure. Some of you may not use Pure yet, but Deb, Emma and I can advise on the easiest way to use it so that you're quite familiar going in and banking whatever you've got to be able to sort of refer to in the future. And very briefly, here's the three of us in the team. Deb supports biological sciences supports medical sciences and I'm health sciences, but we can help you with all sorts of areas of impact, and we're here to help. And it's great to be away from the ref bubble that we were in for months and months, well, about a year and a half. So it's great to be able to be proactive again and get out into divisions and schools. And that's it from me.